Good morning and welcome back to the 71st session of the Regional Committee. Good morning to all of you. Good afternoon to those of you reaching us and with us in the eastern part of the region. Welcome back to our second day. Today is our technical day. Next to primary care, we'll be covering issues of immunization, mental health, as well as the measurement framework for the European Programme of Work. Later in the afternoon, we will start our governance segment with a discussion on Programme Budget 2022-2023 and the regional implementation and issues regarding sustainable financing. But before that, we have some catching up to do from yesterday, from items 2 and 3. So without further ado, I'm going to hand over to our Chair, Minister Olgierd Mănăstiriu.
Thank you, Rob. Good morning, dear colleagues, Regional Director, and a warm welcome back to the proceedings of the second day of the 71st session of the Regional Committee of the WHO European Region. I hope you have had a restful evening and you are energized to move forward into our agenda. Before we move to agenda item 5, we need to finish the discussion on items 2 and 3, get the Secretariat's reply on the COVID-19 lessons learned session, and consider the adoption of the draft resolution on the Regional Director's report. So let us first go back to our pre-established list of speakers of yesterday from Member States' delegations. Then I will also invite international partners organizations who express their wish to intervene to take the floor. If any other delegations that are not yet listed here would still wish to intervene, please raise your hand on Zoom now, as I am about to close the speakers list on item 2. I'm going to read the list of the remaining member states. I'm waiting to proceed with the list. Can I have it on the screen? I'm still waiting, or please to send us here on the table the list of speakers. Yes. So I see that Denmark. We were going to start with Denmark, and followed by Belarus. So the floor is yours.
Your Royal Highness, Director General, Regional Director, Chair, Ministers and Delegates. Denmark fully aligns itself with the statement made on behalf of the EU and its member states. We welcome the Director General's update on the global WHO transformation process and thanks the Regional Director for his address on the state of the health in the WHO European region. The COVID-19 pandemic has underlined the vital role of WHO and its continued leadership in global health. We have come a long way through strong collaboration and mobilization of resources within the European region and across the world. Looking beyond the current pandemic, we need to invest in prevention and preparedness through an integrated One Health approach. This will enable us to better address emerging risks from the interaction between humans, animals, and the environment. We need to focus on systems of health, not in systems of treatments. And during the pandemic, digital solutions have proven beneficial in delivering innovative and patient-centered care. We should use this experience to strengthen our health system. By investing in primary health care and prevention, we can respond more effectively and equally to both health emergencies and other pressing health challenges, such as non-communicable diseases and mental health. The normative role and the core mandate of WHO should be highest priority in the transformation process, and to optimize WHO's impact at both the country, regional, and global level. Flexible and sustainable financing is needed. With continued investment in health as a fundamental human right, we can reach our goals for the state of health and well-being in the WHO European Union as well as globally. In our role as members of the Executive Board, Denmark will support ongoing efforts to achieve the WHO transformation agenda and build a more coherent global health architecture. Thank you.
Thank you. And now I invite Belarus to take the floor.
Уважаемый господин директор, доктор Тедрос, уважаемый господин региональный директор, доктор Ханс Клюге.
Hans Kluge, Madam Executive President, in accordance with the priorities of the WHO EPW 2025, United Action for Better Health in Europe, Belarus has ensured universal access to medical services, medicines, vaccines, and medical devices. Our healthcare system has the trained workers that it needs. Health exams are being carried out throughout the population, and we are also conducting medical screenings through the active support of experts of WHO Europe and the country office of WHO in Belarus. We've drawn up and adopted a state program called Public Health and Demographic Security 2021-2025, which will allow us to attain national security targets for the country in terms of health and demographic security, as well as to achieve SDGs on a national level. And it's aimed at achieving clearly defined public health goals. We're actively vaccinating our population against COVID-19. We've localized production of the Sputnik V vaccine. We're developing a Belarusian vaccine. Based on a risk factor analysis, we are working to improve health literacy, including in the context of the COVID-19 pandemic. The COVID-19 pandemic has triggered economic crises as well as health crises throughout the world. Our country was able to avoid a hard lockdown, which in some countries has led to humanitarian, economic, and social crises. Our test, track, and control strategy, which was adopted and implemented in Belarus, has produced excellent results to stabilize the functioning of our healthcare system. We have not had and are not experiencing a shortage of hospital beds or of ventilators or medical personnel. This shows that the current crisis has shown the importance of resources and political will for the rapid realization of ideas and agreements. We will be happy to share our experience with colleagues from other countries. The pandemic has shown that no one was ready for this kind of crisis, and we are even less prepared for the looming consequences of climate change, declining biodiversity, the growth in disease rates due to air pollution, lack of access to water resources, urbanization, and waste management. We have seen the need for inclusive recovery, which is also key to preventing the spread of the pandemic. To restore healthcare systems after the crisis caused by COVID-19 and to surmount its consequences, we are monitoring and analyzing crisis response measures adopted in Belarus. In light of the short-term need to put an end to the pandemic and relaunch our economy, we are taking certain preliminary measures, including improving epidemiological security and reducing disease rates in the population, and by organizing vaccinations of the population, as well as minimizing the after effects of COVID infection in recovered patients and providing for rehabilitation, as well as vaccinating people against the flu developing infrastructure for healthcare, including by building outpatient facilities, healthcare centers, hospitals, hospital treatment facilities, establishing 12 interregional centers for specialized medical treatment, instructing bone marrow and stem cell transplant centers, a national ophthalmological center for innovative technologies, innovative projects to introduce hybrid surgical methods for cardiological operations. In addition, as part of this campaign, we plan to unroll our Patient Centers That Care project. This involves changing registration procedures, providing for a clear patient routing system, and optimized medical employment. Other initial measures we've taken include providing healthcare facilities with diagnostic equipment, including angiograms, MRIs, and CT scans. We are also computerizing medicine, including by establishing a central computerized healthcare system. That is a cross-cutting project combining computing, IT, and telecom infrastructure, which can serve as a basis for fully electronic services for state and administrative procedures. As part of this project, we also plan to develop a system to support clinical decision-making in order to increase the quality of medical treatment as well as management decisions. We place great importance on establishing a safe space for patients by introducing an accreditation system for our healthcare system. Our ministry broadly supports the 4 flagship initiatives of WHO Europe, supporting mental health. Second, empowerment through digital health. Third, the European Immunization Agenda 2030. And fourth, healthier behaviors incorporating behavioral and cultural insights. And I tried to cover that in my report. I also would like, in light of recently concluded agreements, to thank you, Dr. Kluge, for accepting our invitation to take part in a meeting of the CIS Health Cooperation Council this October in Minsk, during which we plan to sign a country memorandum and an updated memorandum on expanded cooperation between the Health Cooperation Council, the CIS, and the WHO Europe office. Thank you for your attention.
Thank you. This concludes the interventions of the member states, and now I invite international partner organizations to have the floor, started with the United Nations Population Fund. Ms. Alana Armitage, Regional Director. Please, you have the floor. Few moments, Adana is arriving, yeah.
Madam President, WHO Director General, WHO Regional Director, distinguished delegates, colleagues, and friends, thank you for the opportunity to address WHO Europe's 71st Regional Committee. On behalf of UNFPA, our sincere appreciation to WHO Europe, and particularly to Dr. Hans Kluge for his excellent report and outstanding leadership. In this challenging environment, WHO Europe's clear vision, set out in the European Programme of Work, has facilitated partnerships and collective commitments for addressing the pandemic and achieving the SDGs by 2030. As we see evidence of increased numbers of maternal death and stillbirths, as well as violence against women within the context of COVID-19, our collaboration is more important than ever. Together with member states, we're working to ensure that women and young people continue to access essential sexual and reproductive health services and information. And we see real progress as countries develop and implement national sexual and reproductive health action plans. As we heard yesterday, young people are particularly vulnerable to setbacks to their health during the pandemic, especially mental and sexual and reproductive health. That's why we work with WHO, UNICEF, and others to ensure the pandemic doesn't affect young people's ability to fulfill their potential. We're also pleased with our expanded partnership with WHO on healthy aging. Together, we launched a new regional program to uphold the rights and dignity of older persons through health, social care, and enabling environments. Later this month, we will co-host, together with the government of Serbia, the regional launch of the Global Report on Ageism to tackle the ageist attitudes that lead to poorer physical and mental health for older and younger persons in our region. And in December, together with the government of Bulgaria, we will host the first ever Regional Demographic Resilience Conference, which will highlight health as a key component of strengthening human capital. Madam President, distinguished delegates, Regional Director, I'd like to conclude by expressing UNFPA's deep gratitude to the region's heroes, the frontline health workers, ministers of health, health experts and policymakers, as well as the entire staff of WHO. UNFPA reiterates its commitment to WHO and member states to promote the health and well-being of all people of the European region. I thank you.
Thank you, Ms. Armitage. And now I invite UN Development Coordination Office, Ms. Guy Epstein, Regional Director for Europe, to have the floor, followed by Secretariat of WHO Framework Convention on Tobacco Control.
Thank you so much for inviting me to this important meeting, and I apologize that I had to do the recording message. Let me start by expressing my full appreciation to WHO Regional Director Hans Kluge for his leadership. After more than a year and a half of fight against the COVID pandemic, there still isn't a single day COVID is not on the headline news. One day, it is about a new variant or vaccine hesitancy. Another day, it is about the impact on economy or on education. COVID has cut through all aspects of our lives. The new regional program of work for WHO, United Action for Better Health in Europe, recognizes and underscores the critical importance of forging partnerships across organizations, sectors, and partners to combat the pandemic and to achieve the Sustainable Development Goals. The UN Secretary General's vision on the development system reform has been very clear. With the reinvigorated UN country team and empowered regional coordinators, the development system stays relevant, is fit for purpose, works collaboratively, and builds partnerships. The development system is to be effective, accountable, and coordinated to support the government in the attainment of the Sustainable Development Goals. In this regard, WHO has been a critical and indispensable member of the UN country team. WHO has exercised its leadership on COVID health response as a collaborative member, ensuring a cohesive and coordinated response. WHO has been an exemplary model, and without WHO's proactive participation and support, the development system would not have passed the litmus test of the reform that the SG launched 2.5 years ago. WHO has been a pivotal partner in helping to build back better and helping pave the road for healthier and greener economies. So let me take this opportunity to thank all the WHO representatives working at the front line for their unquestionable support for the regional coordinators, and Hans Kluge for his unwavering leadership. But the work is not done. As our Secretary General has stressed, the pandemic has exposed long-ignored risks, including inadequate health systems, gaps in social protection, and structural inequalities. Tackling huge inequalities in the pan-European region, within and between countries, is our biggest challenge. So here is a critical recommendation that has already been made in the COVID-19 and universal health coverage policy brief of the SG. The UN calls on member states to lend greater urgency to the quest for universal health coverage. It is a call for action for greater investments in public health, strong health system, emergency preparedness, and resilience of populations. It is time for solidarity, collective action, and united efforts of all the leaders so that we will not be broken down by COVID, but break through to a healthier and greener future. The UN development system in Europe is committed to supporting the member states in the achievement of the SDGs to ensure there is no one left behind. In closing, I would like to once again express my sincere thanks to WHO Regional Director Hans Kluge and reaffirm that the United Nations Development System and the Development Coordination Office stand ready to support the full implementation of the United Action for Better Health in Europe. Thank you very much.
Thank you. And now I give the floor to the representative of the Secretariat of WHO Framework Convention on Tobacco Control.
Thank you, Madam President. Director General, Regional Director, distinguished delegates, thank you for the opportunity to address the Regional Committee. Tobacco use remains a key public health concern, especially in the European region, which has the highest level of tobacco use prevalence among adults and adolescents. As was expressed by the Regional Director, this concern is even more pressing as COVID-19 outcomes are worse among people with pre-existing conditions, including cardiovascular and chronic respiratory conditions, cancers, and diabetes. And the common risk factor for these diseases is tobacco use. In the European region, which already has the highest smoking prevalence globally among women, some countries saw an even further increase in female smoking prevalence. Tobacco use among adolescents in the region is also increasing, approaching that of adults. Correcting these worrying trends will require strong policy measures and the implementation of gender-responsive strategies, even now in the midst of the COVID-19 pandemic. The COVID-19 has ravaged communities globally, yet the tobacco industry has taken advantage of our vulnerabilities and has used the pandemic to offer assistance to government, even while continuing to interfere with the implementation of effective tobacco control measures. Government-wide implementation of Article 5.3 of the WHO FCTC is the clear remedy to protect tobacco control policies. In recent years, we have witnessed a growing need to regulate novel and emerging tobacco products and nicotine products, such as heated tobacco products and electronic nicotine delivery systems. And the European region leads in such activity, with 57% of countries having adopted regulatory measures. But while the region has a high level of ratification of the WHO FCTC, its implementation rates remain low and clearly require intensification. I also urge all parties to the Convention to join others across the globe in further strengthening our collective actions by ratifying the protocol to eliminate trade in tobacco products. Finally, I call on parties to participate in the upcoming 9th session of the Conference of the Parties to the WHO FCTC and the second meeting of the parties to the protocol to be held virtually in November. Only by pushing forward together, we can build healthier, more resilient populations. Thank you.
Thank you. And now I give the floor to the International Atomic Energy Agency. The floor is yours. There is a technical problem. We do not have sound. Please check your microphone.
Can you hear me now, Chair?
Yes, perfect. Thank you.
Apologies.
You have the floor.
Honorable Ministers, dear Chair, distinguished delegates, the International Atomic Energy Agency, IAEA, is mandated to accelerate and enlarge the contribution of nuclear science and technology to promote sustainable development, including on health, and has been supporting its member states in the achievement of the Sustainable Development Goals. It helps countries access technologies that support them in establishing high-quality healthcare and works closely with key partners such as the World Health Organization, leading NGOs, and international financial institutions. The IAEA supports member states in building and strengthening their capacities related to prevention, diagnosis, management, and treatment of a wide range of diseases. The burden of disease associated with poor nutrition continues to grow in the European region. Poor diet, overweight, and obesity, contribute to a large proportion of non-communicable diseases, including cardiovascular disease and cancer, the two main killers in the region. Stable isotope techniques generate accurate data that provide evidence for improving nutrition interventions and programs. Cancer in Europe and Central Asia is one of the priority health issues. The IAEA is doing its utmost to help member states achieve SDG 3. Jointly with WHO and the International Agency for Research on Cancer, the IAEA helps member states to develop comprehensive cancer control programs by assisting them to assess their needs and formulate evidence-based policies and programs in response. IAEA covers radiation medicine for communicable and non-communicable diseases diagnosis and treatment, as well as supporting member states in ensuring the radiation safety of patients, medical staff, and the environment. Specifically, the IAEA helps member states use radiology and nuclear medicine to diagnose, manage, and treat cancer and other conditions. We are also working to increase access and quality of radiotherapy and medical imaging services. Radiation safety is crucially important when nuclear technologies and radiation sources are being used, so the IAEA supports quality assurance and quality control programs in nuclear technologies. The IAEA is also able to respond quickly to health emergencies. From the outset of this pandemic, the IAEA has helped almost 130 countries and territories by delivering COVID-19 packages of RT-PCR and diagnostic kits and other related equipment, including diagnostic equipment and personal protective equipment, to enable the diagnosis of the virus. At the end of 2021, 24 member states from the Europe and Central Asia region have requested and received a total of 50 packages. According to an IAEA survey that evaluated the impact of COVID on cardiac diagnostic testing, the COVID-19 pandemic resulted in a reduction in cardiac imaging in Europe of 45% in March of 2020 versus 41% and the rest of the world, 69% versus 63% in April 2020, compared with 2019, with the largest reduction in Southern Europe. In April 2020, lower gross domestic product and higher COVID-19 deaths were independent predictions of the reduction in cardiac imaging. In June last year, the IAEA launched the Zoonotic Diseases Integrated Action, Zodiac, to strengthen global preparedness to tackle future zoonotic diseases outbreaks by contributing to establish a worldwide network of national veterinary laboratories and strengthen their technical capacities for the monitoring, surveillance, early detection, and control of zoonotic disease outbreaks, such as COVID-19, Ebola, and Zika. In 2019, the IAEA launched the Women's Cancer Partnership Initiative and, among others, signed a memorandum of understanding with the Islamic Development Bank. In addition, in Uzbekistan, an impact review was first conducted in 2014. Based on the review recommendations, Uzbekistan has decided to expand its cancer care facilities across the country and has secured significant ISDB loan funding in 2021. To help guide the national expansion efforts and to ensure its integration in the broader national cancer control strategy, the IAEA, WHO, and IARC, at the request of the Ministry of Health, are currently conducting a second impact review. The IAEA will remain WHO's committed partner in its noble mission of promoting and improving access to universal health care in the European region. Thank you.
Thank you. And now I'd like to give the floor to the International Federation of Red Cross and Red Crescent Societies, Ms. Bridget Epstein, Regional Director for Europe. Thank you.
So I will be doing this from a very unforeseen location, but I'll do it. On the behalf of the International Federation of Red Cross and Crescent Societies, I thank you for the opportunity to share our view on the health status of the population in the WHO European region in the context of the ongoing pandemic and a strong focus on leaving no one behind. The pandemic has, as we've heard in many of the interventions, become a serious test not only for our national health systems, but also for the resilience of our local communities and for health equity. With the support from the IFRC emergency appeal, from governments, and from many other partners, the Red Cross and Crescent societies in Europe have actively contributed to the prevention, the treatment of the disease, and the National Society have been present in the communities through our network of thousands of volunteers. Today, we can count that more than 100 million people in Europe region have received different types of Red Cross and Crescent support. From the very first phase of the pandemic, IFRC and the national societies in the region have been playing a key auxiliary role. And as the pandemic evolved, been developing tools for dissemination and prevention, for food delivery, for walking dog arrangements, for virtual visit services, transport to vaccine places, and handling vaccine facilities. The National Society is also providing pre-hospital care and medical services to the affected people. They're supporting public health measures to control the outbreak, such as running testing stations, engaging with the communities to track and counter misinformation. In addition, we've been providing lots of mental health and psychosocial support to isolated, to caregivers, and to other vulnerable members of communities. This strong national society volunteer base, of which roughly half are young people, is what makes the Red Cross and Crescent really powerful. And I'm proud to say that our community presence is bigger than ever. The Red Cross and Crescent societies during the pandemic have seen an increase in new volunteers, allowing us to tap into local resources and build new volunteer communities, also digitally. During the pandemic, co-creation, joint activities, and partnerships continue to be of central importance in terms of response and recovery. And for example, the WHO UN Red Cross COVID-19 platform has been a key source of information sharing and cooperation. And this Saturday, the Chinese and Georgia Red Crosses, in close collaboration with their respective ministries of health, facilitated 100,000 urgently needed Sinopharm vaccine doses to Georgia. I think this is just the beginning. As mentioned by Dr. Kluge, we signed an MOU, a new MOU last week that captures our joint commitment with WHO Europe to work together to achieve a very common aim, improving the lives of the most vulnerable and reducing or eliminating avoidable inequities in health conditions. In the light of the current pandemic, we will continue to adapt to new realities and prepare for future pandemics and other health crises. This requires more emphasis on development of health technologies and new partnerships, building on the many lessons already gained during the pandemic. IFRC endorses the addresses of the WHO Director General and the Europe Regional Director, and stands ready to partner with governments, UN agencies, civil society, the corporate sector, and the communities, of course, themselves, to turn our common goals and ambitions into reality. Thank you very much.
Thank you for your intervention. And once more, I would like to check if there are still member states who didn't speak so far, who still want to take the floor, to please raise their hand in Zoom. If there are member states, no, then I'd like to inform Regional Committee that we have no joint statements from non-state actors on this item. We have one written statement from non-state actors that we will show on the screen. We can, yes, we can show on the screen, and this concludes the discussion on item 2. If there are not member states that, yeah. Turkey is on, yeah. From the international partner organizations. There is one more organization that wants to take the floor. The Cooperation Council of Turkic-speaking states, Mr. Mirvakit Azimov, Deputy Secretary General. The floor is yours. I have to call once again for Mr. Deputy Secretary General.
Good morning. Dear President, Director General, Regional Director, distinguished delegates, ladies and gentlemen, I would like to express my gratitude to the Regional Director of WHO of Europe, Dr. Hans Kullige, for inviting the Cooperation Council of Turkic-speaking states to the 71st session of the Regional Committee for Europe. Turkic Council, being a comprehensive regional cooperation organization for our member states, namely Azerbaijan, Kazakhstan, Kyrgyzstan, Turkey and Uzbekistan, as well as observer state Hungary, attends this committee meeting for the second time. Since the beginning of the pandemic crisis, we are showing utmost efforts to contribute to the fight against COVID-19 and its negative effects. Turkic Council became the first international organization which held the extraordinary video summit at the level of heads of state on the fight against COVID-19. Later, the meetings of the ministers of health to implement instructions of the heads of states were held. As a result of those meetings, we have established a permanent health coordination committee, a supply chain group to provide each other with medicine and medical equipment, and the health scientific group to exchange experience among medical professionals. Subsequently, in the framework of the Health Scientific Group, we held a face-to-face vaccine workshop organized by the Ministry of Health of Turkey in 2020, and many online meetings to update each other and share treatment protocols. Dear participants, as you can realize, the heads of member states also put a special emphasis for close cooperation with WHO, and therefore we have been in close contact with the organization since the outbreak of the pandemic. Based on this instruction, Secretary General and the WHO Regional Director signed an MOU on 11 September 2020 with the aim of establishing a legal basis for future engagements. For implementing the aforementioned MOU, the Secretariat and WHO Istanbul office, together with the Minister of Health of the Republic of Turkey, are preparing a three-phase project called Strengthening Emergency Medical Care Systems in the member states of the Turkic Council that will take place in Azerbaijan and later in other member countries. We strongly support the WHO European Regional Office to unite efforts of regional multilateral institutions and mechanisms around health as one of the key objectives of the European Programme of Work for 2020-2025. As a representative of the Turkic Council, Professor Emine Altmeşe, in her capacity as the chair of the Health Scientific Group of the Turkic Council, also contribute to the work of the Scientific Advisory Board of the Pan-European Commission on Health and Sustainable Development. Additionally, together with WHO Europe, we will finalize a draft action plan for the implementation of the MOU and plan to organize online training programs for health professionals to accelerate the implementation of the International Health Regulation in 2005, to improve high vaccination coverage, conduct capacity building for data, and health information systems. Finally, I would like to reaffirm that Turkic Council is ready to coordinate and support all the efforts, not only in the fight against COVID-19, but also in the post-pandemic period in the other areas of health sector. I believe we will leave these challenging days behind by establishing solid cooperation among all the countries. Thank you for your attention, and I wish you success in your deliberations. Thank you.
Thank you. This concludes the discussion on item 2. Unfortunately, the Director General is no longer available to be with us for any replies from his side, although the Regional Director replied on the interventions made yesterday, and let me check if he wants to say anything. Dr. Kluge, you have the floor.
Thank you, Madam President, and thank you to Minister Hoyneke and Minister Pinevich for the interventions. I will try to avoid repetition of yesterday, but some very key points were mentioned by Minister Hoyneke from Denmark on the flexible and sustainable financing, and I think this is something that we cannot repeat enough. Then also on the One Health, which is at the core of the Monti report, and there were different interventions yesterday linked also with the climate change. With Dr. Pinevich from Belarus, thank you for the support to the 4 flagships. Indeed, we are looking forward to sign the next biannual collaborative agreement and also the MOU with the CIS Council on Healthcare Cooperation. My appreciation to all the partners. As I was mentioning yesterday, I really believe in the power of positive partnership. Thank you to the Regional Director, Alana from UNFPA, on our close collaboration on several issues, not at least sexual reproductive health and mental health, the prevention of violence in women, and healthy aging. Thank you very much to Guy from UNDCO. I can also confirm only that the link between our country offices and the regional office in Copenhagen and the UN resident coordinators have only strengthened in the last year, which is so crucial because the pandemic and health also goes far beyond the health sector. And thank you for all the support by your UN resident coordinators during my field visits. WHO Framework Convention on Tobacco Control, indeed, we cannot be complacent and have to push really the boundaries further against the deadly fight of tobacco, because it's still the #1 killer and absolutely preventable. And of course, we have to help the people who are addicted and who have trouble to stop. The International Atomic Energy Agency, we really would like for the next year to strengthen our collaboration in the pan-European movement United Action Against Cancer. And I'm very, very keen to meet in person. On the IFRC, thank you very much, Brigitte, for your intervention. Honestly, I was very impressed. I feel that my TED Talk was very small compared to the intervention that you pulled off at the street to be with us by hook and by crook, which, frankly speaking, really testifies of how operational the IFRC is and the community engagement to work with young people. And this is really a silver lining in the crisis, that you're telling that the number of volunteers increased. I mean, congratulations. This is very, very hopeful. In fact, it proves that in adversity, we emerge stronger. And teşekkür ederim to our friends of the Turkic Council. This has been a partnership which is really flourishing in many fields, and I'm very much looking forward to join you at the summit of the heads of state of the Turkic Council later this year in Istanbul. Thank you.
Thank you, Dr. Kluge. And before going to the draft resolution and to the adoption, I'm informed that we have 2 more requests for the floor from Kazakhstan and Montenegro. So I give the floor to the delegation of Kazakhstan. The delegate of Kazakhstan can take the floor. If it is ready, we move on with the representative from Montenegro. Yes, please. Can I make an interruption? The representative from Kazakhstan, please, you can go on air. you have to unmute and to go on air. We can't hear you. Yeah. Now you can try again. No, I think there is a technical problem. I see.
Kazakhstan.
Now, yeah. Yes, now you are on air.
Да, Марат, это где? Спасибо, уважаемый председатель и участники сессии. Казахстан, как и другие страны, в условиях чрезвычайной ситуации стремится обеспечить доступ населения, в том числе уязвимых групп, к основным услугам здравоохранения, не подвергая их финансовым трудностям. И это позволяет сократить рост заболеваемости и смертности, не связанных напрямую с COVID-19. По мнению правительства Казахстана, укрепление ПМСП, внедрение IT-технологий и усиление транспортной медицины влияют на принятие решений по данному вопросу и является одной из ключевых мер реагирования в период COVID и при других ЧС-ситуациях. Согласно декларации Астаны по ПМСП 2018 года, ПМСП является краеугольным камнем устойчивой системы здравоохранения. И необходимо это все для охвата услугами здравоохранения, связанными с достижениями ЦУ. Казахстан на сегодняшний день создал координационный центр по ПМСП совместно с Центром лучших практик, который содействует их внедрению во всех регионах страны. Мы расширили работу передвижных медицинских комплексов. Для иммунопрофилактики населения нами широко используются возможности IT-технологий. Внедрено мобильное приложение АШИК для определения эпидстатуса гражданина с дальнейшей интеграцией с единым интеграционным порталом ПЦР-тестирования на COVID-19. В частности, получение результатов лабораторных анализов на COVID-19 граждан Казахстана. Второе. Разработан и внедрен электронный паспорт вакцинации, который на сегодняшний день признан 60 странами государств-членов ВОЗ. Казахстан поддерживает инициативу ВОЗ о равном доступе к вакцинации, ведь несправедливое распределение вакцин подрывает не только здоровье людей, но и восстановление мировой экономики. Необходимо продолжить информационно-разъяснительную работу с населением о важности вакцинации. На сегодняшний день мы поддерживаем представленные ВОЗ совместно с государственными членами 10 уроков, извлеченных на данный момент из пандемии COVID-19. Уважаемый доктор Клюге, коллеги и делегаты, пандемия COVID затронула все страны, и только совместными усилиями, совместными действиями глобального сообщества мы можем справиться и вернуться к обычной жизни. Казахстан поддерживает дальнейшие усилия по укреплению сотрудничества со Всемирной организацией здравоохранения, государственными членами ВОЗ в целях охраны здоровья населения. Благодарю за внимание.
Thank you. And now I hand the floor to the representative of Montenegro. You have the floor.
Good morning, everyone. Can you hear me? Okay, I will read statement on behalf of Minister of Health, Dr. Jelena Boronović-Bojović, regarding the COVID-19 lessons learned. Your Excellencies, WHO Regional Director, Ministers of Health, esteemed colleagues. I would like to thank the Regional Director and staff of Montenegrin Country Office for their continuing support in many areas to improve the health and well-being of the citizens of Montenegro. An area which has received recent and welcomed attention is in the field of digital health. This is an important strategic growth area for our country and the Western Balkan region as a whole. I was particularly interested to learn of the new knowledge product which the WHO Europe Digital Health Flagship Initiative will deliver, such as forthcoming roadmap for the digital transformation of the health systems and new networks providing support on digital health to member states. On this note, I would like to draw the attention of the Western Balkan ministers to a special upcoming event and thank the Regional Director in advance for joining in opening the upcoming Western Balkan Digital Summit in Podgorica on October 11, where the first WHO sub-regional network for digital health in the region will also be launched. Together, we have firmly put public health on the agenda of this regional summit and will bring a call to action for the need for digital health and public health communities to collaborate more closely to accelerate the digital transformation health system in Western Balkans and ensure that future digital services are designed with equity, gender, and human rights at their heart. Thank you.
Now, thank you. This concludes the discussion on item 2. And we can now consider adoption of the proposed draft resolution contained in the report of the Regional Director on the work of WHO in the European region. Is the committee willing to adopt the proposed draft resolution by consensus? I see no objection. The resolution is therefore adopted.